I'm Dr. Vidisha Guhani Yogi, practicing dermatologist from Durgapur. Today we are going to speak about retinols. This product has been there for a long time. Retinols are derivatives of vitamin A. The product retinol in many manner is available both over the counter as well as in prescription drugs. Over the counter products have lesser amount of retinols, and dermatologically requirement levels are found in our prescription drugs. These products can be available in the form of cream, lotion or serum. The utility of retinols is mainly it smoothens the skin by decreasing wrinkles, by decreasing melanin production, so hyperpigmentary spots can get decreased. It also works against open pores, and it produces an increased elasticity of the skin. The reason for all this is because of the basic nature of retinol. That is why in one portion of the retinols are used for treating acne. It opens up clogged skin, and that's how it decreases the comedones. In another way, the collagen synthesis is increased, the elasticity of this is increased, and also the melanin production is decreased. So all these factors leads to a long-term effect of anti-aging effect on the skin. But before retinols are used, we have to prime up the skin for it, because Indian skin has a tendency to be dry, and also because we are more exposed to sunlight. That's why sunscreens are very important along with retinol in the morning times. Always retinols are advised to be given in the night times. Skin has to be soft, so little bit of moisturization is required during the use of retinols. Overuse of retinols can cause dryness of skin, irritation and severe redness. In order to avoid this, as a rule it is given in as short contact therapy initially, or it can be tried, a little bit of patch testing can be done with when we give stronger retinol. That is, little bit of the ointment is applied, kept for some time, and if there is no irritation, then it can be continued. But as a rule, everyday use of retinol can be a little harmful to the skin too. It can cause severe burning and erythema and scaling of the skin. But the same thing is, if it is given by proper dermatologists and by proper advice, then we can have decrease in the wrinkles, decrease in sunspots, decrease in solar keratosis, a lot of conditions, decrease in open pores, which finally, and a little plumping of the skin, which gives the result of younger skin. So for anti-aging effect, use of retinol has been proved over and over again, but not in the manner that it is being used in the market without proper priming of the skin or taking care of the skin. Taking care of the skin becomes ultra important when we use retinols, like use of sunscreen, use of moisturizers, and using it for its beneficial effect. Thank you. If you feel my talk has helped you, you can request for other topics and I can give you the next video.